Hi, I'm Jocelyn. This presentation represents the position for the debate topic that breastfeeding should be the expected feeding method for all newborns and formula access should be restricted to those with medical indications. The core issue at the heart of this topic is, should formula access be restricted? This question has been debated before, especially in the hospital context, and restrictions on marketing of breast milk substitutes are widely accepted. Recent formula shortages lead to the question, is it time to go beyond restricting marketing to restricting access? If you're watching this video thinking it's very one-sided, you are right. This is the argument for restricting formula access. Some gendered language is used. In practice, always use the language an individual chooses. Definitions. I am using Health Canada's definition of exclusive breastfeeding, meaning that an infant is fed only maternal breast milk. By expected, I mean that healthcare policy and practice should be built with breastfeeding as a baseline, not a choice or an option. Formula refers to approved commercial products. I am using restricted to mean prescription only, and medical indications refers to those listed by the World Health Organization as acceptable reasons for using breast milk substitutes. To outline my argument, breastfeeding is the normal and ideal method of infant feeding. Formula is a medical intervention and a limited resource. Therefore, it's clear that breastfeeding should be the expected feeding method for all newborns. Formula access should be restricted to those with medical indications. Breastfeeding is the normal and ideal method of infant feeding. This is well established and supported by position statements and guidelines from WHO, UNICEF, Public Health Agency of Canada, American Academy of Pediatrics, CDC, Registered Nurses Association of Ontario, the Association of Women's Health, Obstetric and Neonatal Nurses, and others. In fact, no legitimate opposition to this premise exists. I'm going to use the Canadian Pediatric Society statement here. Breastfeeding is normal, unequaled, and recommended exclusively with very few medical exceptions. Less known facts about the importance of breastfeeding are the changes in risk of cancer, hypertension, diabetes, and cardiovascular disease for women who do not breastfeed. There is a higher incidence of illness and SIDS in the short term and chronic disease in the long term for babies who are not breastfed. As a society, we need to acknowledge the cost to all of us when babies are not breastfed, both environmental and healthcare system. Non-breastfed infants face increased morbidity, double the risk of otitis media, GI infections, 3.6-fold increase in hospitalization for lower respiratory tract infection, over double the risk of necrotizing enterocolitis for premature babies, which has a case fatality of 15%, and an increase in the risk of SIDS and injury-related infant mortality. All of this adds up to significant healthcare costs, even before accounting for the impact of increased chronic disease. Can we afford to frame breastfeeding as a choice? Formula is absolutely a critical and life-saving tool that is valuable and needed. For some babies, it is their only potential nutrition, and for others, a needed supplement. For women, some women, breastfeeding is medically complicated and they may need to consider not breastfeeding, either temporarily or permanently. You'll notice in each of these examples, though, these mothers and babies will need health care long-term. Why can't formula be treated like other parts of the healthcare plan in these cases, using shared decision-making with a healthcare provider's advice? Formula is a medical intervention that meets criteria for being evaluated for prescription access. Formula has demonstrated risk of harms, not only limited to those listed in the last slide, but also related to use, preparation, and storage. These risks can be decreased by education, support, and supervision from a qualified healthcare professional. Recent closure of the Abbott factory due to failure to maintain FDA standards has set in motion significant formula shortages. Formula is a limited resource that is life-saving and life-sustaining for many children, but with no restrictions, families may consider formula a choice and buy without medical need. Shouldn't formula access be triaged based on need, younger, sicker, and special needs babies first? Other families are buying in excess. A restricted access program could prevent both of these problems while ensuring that those who need it are able to obtain it, and in the case that they can't, they will have long-standing relationships with healthcare providers who can direct them regarding emergency infant feeding options. Potential barriers include an emphasis on choice, resistance to enforce breastfeeding by healthcare providers. Families will always have a choice, but we don't need to make that choice easy or equal to breastfeeding. We don't frame ambulation after surgery as a choice or feel guilty when we strongly encourage patients to exercise, quit smoking, or get their flu shot. Why should infant feeding be different, be centered on choice? Breastfeeding support and funding are a major barrier, but we know that funding follows best practice and not the other way around. We will not have the funding for breastfeeding support that families need until we erect barriers to formula. Because right now, it's simply easier to tell a woman with breastfeeding difficulty to use formula instead. And of course, there are perverse incentives related to formula company influence and financial gain related to breastfeeding substitutes. Where can we go from here? We have had significant successes with vaccine mandates as a healthcare system to increase uptake. Breastfeeding mandates through restricted formula access can increase breastfeeding rates while supporting medically indicated formula use. Restricting formula access would mean that all families get healthcare support with breastfeeding problems before accessing alternatives. In conclusion, breastfeeding should be the expected feeding method for all newborns, and formula access should be restricted to those with medical indications. Thank you.